Eastern Melbourne Medicare Local has come a long way in a short time. In our first 2 years of operation, we've chalked up enormous successes. In the 13-14 year, we laid the groundwork for some really powerful healthcare initiatives. We've been paving the way to change our system. The environment around us is changing. The federal government has announced a move to primary healthcare networks. But what's important to us as a Medicare Local is to maintain the great things that have been achieved in a short period of time and to carry those things into our new healthcare future. During the year, we did an enormous amount of planning and preparatory work for some really important initiatives. We developed EMSIC, the Eastern Metropolitan Social Issues Council, a council designed to bring together a range of key players across a range of industries that impact on people's health and well-being. We've also established a clinical council and a community advisory committee, all designed to feed into the board's decision-making about our healthcare.
But an overwhelming majority, 90+% of Australians, say that ageing must be a national health priority. And that's one thing that Eastern Melbourne Medical Local would like to explore further and put on the agenda and promote the sorts of things we might do to address that community concern.
We've established Eastern Melbourne Health Pathways, another project specifically designed to make the system easier to navigate for GPs and for their patients. Moving a step beyond health pathways, we've commenced collecting stories from people about their experience with the health system. This is designed to assist other people to use the system more effectively and better improve their health. GPs remain the cornerstone of our work. From health pathways to things like our professional development events, it's important to us that they work through and with the system to improve their patients' health. We held 48 professional development events in the 13-14 financial year with 925 attendees. We also continue to provide support to general practice directly in their practices. Across a range of quality improvement programs, things like pharmacy, Aboriginal health, immunisation, we deliver services directly to GPs in their practice. We also support clinical placements into general practice and a range of other providers across the region. Eastern Melbourne Medicare Local is the only Medicare Local that provides fellowship preparation courses for the RACGP written exams. Last year we had over 60 GPs participate and prepare to sit their exams. The demand from GPs is enormous and these courses continue to grow. We released our second round of national benchmark research into the health system and people's experience of it. What it did tell us yet again is that Australians hold their GPs in enormously high regard. Over 87% believe that their relationship with their GP is a good one. Partnerships have always been significant to us at Eastern Melbourne Medicare Local. We know for absolute fact that the health system works best when primary and secondary care providers work together. In the past year, we've really strengthened our relationship with the acute services, in particular with Eastern Health, and have worked with them on a range of projects, including health pathways, but also a range of clinical initiatives, including our Headspace service and our mental health services. This year we worked with Eastern Health around a winter campaign to divert people from the emergency department. This community awareness campaign was designed to show the community that there are alternatives for after-hours care. The campaign included radio advertisements, print advertising, bus shelters and buses themselves. Mental health continues to be a priority for Eastern Melbourne Medicare Local and in particular youth mental health. Our Headspace Knox service saw over 1,000 young people in its first year of operation and we celebrated our first birthday in April.
I'd just like to say a very big thank you to the people who make this centre happen. It's the Medicare Local and the other consortia providers, it's the Youth Advisory Council, but it's most importantly the staff here who are here doing the hard work on a day-to-day basis. Thank you for everything you do. You are changing lives and please keep up the great work.
Our Partners in Recovery program has been a national success story. We've met our targets and seen an enormous number of people who would otherwise have fallen through the gaps in our healthcare system. 2013-14 was yet another big year for Eastern Melbourne Medicare Local. Moving into the future, there will be different organisations taking on our role in primary healthcare. The primary health networks will change, will move differently to what the Medicare locals did, but it's important that we don't lose the really good quality work that has been done to date. My enormous thanks go to our staff whose passion, whose experience, whose care about what they do has given us the success that we have today. I also wish to acknowledge our board who provide guidance and direction to myself and to the staff, and to our many, many partners who participate and who allow us to achieve the things that we could not achieve alone. All of these people together make up Eastern Melbourne Medicare Local, and I'm absolutely proud to have had the opportunity to lead it, and I look forward to a new and exciting future.